One strategy you guys can use to help navigate around your knee pain is we can do what's called mulligan technique. It's kind of a mobility drill that you guys can do where we're trying to find the best way to minimize the pain involved with a particular movement. In this case, it's going to be knee flexion. So let's say squatting hurts, okay, and we get knee pain. One way we can navigate around this is I can put my leg up on it. Let's just say it's my left knee that's the problem. And I take it forward and I get pain wherever that may be. One thing I can do is I can grab below, kind of where the knee is. And what I'm going to do is I'm going to first traction outwards. So I'm twisting everything kind of that way and repeating the movement, okay? And this may actually feel better. If that's the case, stick with that one. And so what I'll do is I'll just repeat that movement around 10 times. And I'll try repeating the movement that was painful previously. Again, maybe it's squatting, okay? Maybe it's not this way. Maybe it's twisting it inwards instead, okay? So I can twist it inwards. Another thing you can do is you can press on either side. So maybe I'm going to press outwards and take my foot or my knee forward, okay? A lot of this is so much like exploration that you guys kind of have to just trial and error, okay? So again, you've got a couple here. I'm going to show you another way you can do this with a band. Another way we can navigate around knee pain is we can use what's called a heavy resistance band. You can get these on Amazon. Usually they're relatively cheap, come in a large pack. Multiple things you can do with those, even including just like workout or strength stuff as well, providing with your resistance training. How I'm going to use this is we're going to do essentially what is called a Spanish squat. I'm going to step through this band with the knee that's affected, and you're going to notice that I get into like a squat type pattern. If we do have knee pain as we bend down into a squat, this is a good way to kind of help navigate around that, and you might find that it has less pain involved with it too. So it kind of starts the process of helping to load the knee, make it a little bit more resilient, and by proxy have a little bit less pain. Okay? That's all I'm going to do. I'm just going to step through. I'm going to have the band right here behind my knee, and from here, just going to squat down. So it's providing tension this way and allowing me to possibly bypass what is the knee pain as I get down into that knee flexion or squat type position, okay? This is something that might be a repeatable movement as well throughout the course of the day. Maybe you're hitting like 10 every hour. It's just going to kind of depend on your dosage level and how the tolerance is with that. Last thing I'll say with the band too is it doesn't even necessarily need to be in this position where it's tensioning this way. Even if I wanted to, let's just say that I'm working on my right knee and wanted to have tension pulled this way, I can do that as well. It's really going to be, again, kind of dependent upon what works best for you. So for some, it may work well in this position. For some, it may work well in this position. And for some, it may work well pulling towards inward, okay? So there's a couple different variations you guys can use with that. The inward one would be more like this here, okay? So a couple different variations you guys can try out with that. Experiment around. Again, find a repeatable movement that might be a little bit painful, and you can always retest that movement after you've done an intervention like this.